Hi, everyone, and welcome to this episode of Prevention Profiles Take 5. I'm Rich Lucy, Senior Prevention Program Manager here at the Drug Enforcement Administration in its Community Outreach and Prevention Support section. I'm excited about today's guest. She's coming in from Oklahoma. She works for a state government agency. Many of you know that's how I started my career, so I feel there's a kindred spirit here as a guest. Our guest is Emily Morrow-Mueller, and so let me tell you a little bit about her before we start the interview. Emily Morrow-Mueller is a Senior Prevention Programs Manager at the Oklahoma Department of Mental Health and Substance Abuse Services. In this role, she provides training and technical assistance to state field staff and community subgrantees around the strategic prevention framework, evidence-based prevention practices, contract and reporting expectations, and more. In addition to helping equip community coalitions with the skills they need to successfully implement prevention programs, she has also been a central person in building out the higher education prevention network in Oklahoma. Emily is a certified trainer in both prevention ethics and the SPIF, Application for Prevention Success Training. And with that, Emily, welcome to the podcast.
Thank you so much for having me.
Absolutely. And you know, we're shooting this toward the end of February. Earlier this month was CADCA's National Leadership Forum and SAMHSA's Prevention Day. And it was actually during those two events that I saw you present about Oklahoma's Higher Education Prevention Services Network. And it got me excited and thinking, you know what, I think Emily would be a great guest to have on the podcast. And so here we are, and we're going to get into all that and some more a little bit later. So let's start right in. I said earlier at the onset, I'm excited with a kindred spirit. You know, I started my federal career, my home state of New York. I was really blessed, I say, by having a true champion in prevention, Fran Harding, and an agency that really was supportive of doing work, prevention work with colleges and universities. And throughout my career at the state government level, and now for the last 25 years or so at the federal government level, I have heard from campus-based prevention professionals who have difficulty engaging with their state agencies that deal with drug misuse prevention. So what advice do you have for our viewers who are struggling with this and are really trying to engage their state agency?
Yeah. And I know, you came to my presentation at National Prevention Day, and I kind of started out talking about how we have a long history of funding community coalitions across our state. And so I think, we already have some really awesome relationships within our communities, having 20 plus years, 25 years worth of community-based prevention services that are happening. And so, in Oklahoma, when we were starting out our higher education network, we really were able to kind of utilize a lot of those lessons that we had learned with communities to really start to engage with campuses. And for us personally, we directly reached out to the campuses that we are funding. More people are now starting to hear about us and reaching out to us kind of as a result of what they're seeing with those 13 institutions that we fund. But I think, prevention is all about storytelling. And so I would tell people who are really trying to engage with their state agencies, start to do some of that assessment period. When we talk about the strategic prevention framework model, we always start with assessment. And if you're, bidding out for funding, you're showing what that data, you're showing that need. And it costs nothing to start to kind of have those collaborative conversations on your campus to just kind of see what are those high risk factors, what protective factors do we already have on campus? Where do we have gaps? And really just kind of presenting that story so that when you approach a state agency who may have, prevention funding or have prevention programs, you're kind of coming in with that, hey, we're already kind of starting to look into this. This is what we're trying to do, and build those collaborative relationships with your state partners at that point. How could you help connect us? Or is there a community coalition in the area that's already funded that, that the campus could get connected with for resources, and just kind of hearing about how to build capacity, how to assess that readiness, how to improve that readiness on your campus, to set yourself up for prevention funding opportunities in the future. And so it costs nothing to, develop those relationships, to find those key partners on your campus, to really start to tell that story. And that's where I would tell people, like, when we were first starting, we had a campus that we fund now. They reached out to us a few years ago. We were in the middle of a grant cycle. So we didn't have funding opportunities at that time. Higher education was something we knew as going into the next grant cycle. We needed to start to incorporate funding very specifically for higher eds. And they kind of presented their case of like, hey, this is like what we're hoping to do. This is our needs. We remembered that. And, 3 years later, when we had funding available, we were able to reach out to that person and say, hey, do you want to sit down and have a conversation? And so I would also say, like, don't take it as defeat if, something doesn't come about with that right away, because I promise that if I have someone coming and presenting that data and telling their story to me, I'm going to remember that. And when opportunities come about, I'm going to connect. I think it's also, just like in community work, it's all about relationship building. So build those relationships with your state staff. How can you help them? How can you get connected with them? And I think that's also a great way to get your foot into the door with your state.
That's some great advice. And, when you talk about telling your story, I know that in presentations and workshops that I do, we often talk about the elevator pitch and, what is your succinct, what's your pitch, right? Whether it's to the college president, whether it's to the mayor, whether it's to the executive director or commissioner of an agency. And I love the fact that, you're living proof to say, we remembered the story that was told to us. So I think that that's great advice for our viewers is, get your story in mind, continue to hone it all the time, because if you make it memorable, it will be remembered.
Most definitely.
I'm going to get into the statewide initiative in just a minute, but my next question is more generally, from your perspective working in state government, what do you feel are the top prevention-related issues for colleges and universities in your state?
So knowing that a lot of prevention work is funded by grants, sometimes the initiatives that we're working towards may be dictated by what type of funding streams there are. That is the case in Oklahoma. All of our campuses focus on opioid and stimulant misuse prevention. I will tell you, every single one of my campuses has come to me at some point saying, alcohol is our biggest problem. And I think that is probably what every campus across the United States would probably have in common, is saying, alcohol, there's a lot of high risk factors that we see. We have students who, maybe they're in Greek life, maybe they're a student athlete, they're living on their own for the first time, they're making those decisions, they have that peer pressure coming. And so I think we definitely do see increased use of binge drinking on campuses. But I know I was reading a study from Ohio State University not too long ago, and I think the study was a couple of years old, but I think it was like close to 16% of students reported misusing prescription stimulants. And I think, and from what having conversations with our campus partners, is alcohol is that one that like it just really presents itself, and you're seeing the constant like pitfalls from misuse of alcohol. But I think that we don't stop and think about how much opioids and stimulants are also really affecting our college campuses as well. We have like the study drug, this idea that, hey, I'm going to stay up all night the week before finals to really try to cram 16 weeks of work into my mind. And we know that that's not effective. So like thinking about what type of protective factors can we put into place, and realizing that those protective factors, though you may be targeting stimulants and opioids, are also likely going to be helping, students overall have a healthy well-being, have better mental health outcomes, and, decrease use with substances, instilling those, what are some good study habits, instilling like the need for sleep. Like we know that staying up all night the night before a test is not going to give you the outcome you want. Getting a good 8 to 9 hours of sleep is going to give you an even better outcome. And so, just kind of thinking about those types of strategies that you can implement on your campus. I think also we have fentanyl is something that our whole nation is starting to see and deal with. And we've talked to campus law enforcement who, they're like, we don't think we even realize the effects that opioids and stimulants may truly be having on our campus. But like they have that concern with the fentanyl that, a kid's going to go get Adderall to help, as their study drug. is it laced with something at this point? Has it been pressed? And you can have 10 pills and one of those be laced and the other nine be completely fine. And I know through conversations with campus law enforcement, like that is kind of a concern that they're starting to have. I don't think the fentanyl has hit our campuses as hard as I've heard from other states, but we also know that, it kind of works its way into that, into the middle of the country, and that's where Oklahoma is. So I think us funding opioids and stimulants right now is giving us a really great opportunity to hopefully be ahead of what could potentially be coming. I think not talking about like scopes of service, we have some institutional resistance that we've experienced, related to prevention programming. And I think it's that like idea of if we install lock boxes, in all of our dormitory, or if we have a drug take back event on campus, that correlates with student move out, like, is that indicating that there's a problem on our campus? And what is that going to tell the community, the donors, parents? And so we've had to do a lot of education about talking about, prevention is trying to be ahead, it's trying to be proactive versus reactive. And, just because you've not experienced an overdose on your campus, like, doesn't mean that it couldn't happen. So what are your plans now to kind of, prevent you from ever being that story in the newspaper, or, having to have some of that PR that's going to have to come, if you have a student death. And then I think something else is just having such a dynamic population of focus. And it's, and it's the same with our communities. You have this traditional 18 to 24-year-old students. We fund, for us personally, we fund 2-year community colleges, we fund 4-year small colleges, 4-year universities. We're funding in rural areas and urban, and every single one of those campus has a different population dynamic. And so, realizing that programming, especially like when you're new and you're trying to help, navigate so many different campuses through the SPIF process and really through developing their coalitions, is realizing you're truly developing 13 different plans, which is the same with our community coalitions, but just realizing that there's not a one size fits all with prevention programming. Not that we didn't already know that, but the programming that you're using towards that Greek life population, we have one campus where Greek life is very common to be a part of it, versus other campuses where it's a lot of adults who are coming back to school. They're the non-traditional students. There's no one living on campus, and like what their needs are very different. And so I think that's something, for us, that we very quickly realized we needed to take into consideration.
There's so much to, I've been furiously taking some notes, and there's a lot to unpack in what you were just talking about, Emily. And a couple of things I wanted to note. So thank you for mentioning the issue around stimulant misuse. So the Ohio State University's National Prescription Drug Study, which we post the findings on campusdrugprevention.gov when they come out. We always make the connection with our awareness campaign, One Pill Can Kill, because of what you've said, the issue of fake pills and illicit fentanyl. And, we keep trying to push the message out for everyone to hear, that universal message, to not take any medicine that hasn't been prescribed for you by a licensed medical provider and dispensed through a trusted pharmacy. And online social media is not a trusted pharmacy. I mean, that's what we say. But I think that that's really important, that, opioid misuse brings its own set of issues, but so does stimulant misuse, that misguided thinking that it's going to help me get a better grade when there's absolutely no research to indicate that that's true. So I'm glad that you've raised that, and that is an area of focus, I know, in your initiative. I was struck by the issue of the institutional resistance, because for as long as I've been in this field, which is more than 3 decades, it's like it never goes away, that resistance. I've been hearing about that and dealing with that for my entire life. It's not just on college campuses. It's in K-12. It's in the general community. It's in the workplaces. And, the analogy I think of when I just heard your comment about, well, if we install lock boxes, does that mean we have a serious drug problem, and, a lot of kids or students have drug problems? And I think about the AED and the defibrillators, and we make that analogy that just because that is installed in your workplace, it doesn't mean the majority of the folks walking around your workplace have heart problems. That's not, it's for the instance, you hope you never have to use it, but for those rare instances where you might have to use it. So no, it doesn't indicate. It's there as a preventive, right? It goes back to prevention. So I'm glad that you brought that up. I want to ask you a question, and it is an offshoot question. I'm going to get the plug in here for our updated strategic planning guide, Prevention with Purpose. And the new version has a whole new chapter on prevention success through times of disruption. And we talk about 5 different types of disruption. We talk about, a national outbreak of disease. COVID was a big anchor around that. But, we also talk about natural disasters. And along the Gulf, we talk about the hurricanes. Out west, we talk about earthquakes and such. You're in Oklahoma. We know Tornado Alley, right? And I would say typically that's probably happening in the summer time when maybe students aren't around. But from your perspective, are schools thinking about that prevention services during potential times of disruption due to like natural outbreak like that?
So tornado season runs April through June time. So it definitely hits the end of spring semesters. Most of
Yeah.
our campuses go till the end of May. And I know as far as from like being prepared for like what to do in the case of like, should a natural disaster hit, I formerly worked with the University of Oklahoma, and I know that they had a plan of, where we're going to go. I worked for the health center, the student health center on campus. And so, we kind of knew what our role would be should something like that to happen. Same with like active shooting, just kind of, what are the processes? I think it's obviously having a plan and then having to implement in those cases can sometimes run very differently. But I do know that they've kind of thought through that side of things before. Now, kind of connecting it to like that prevention side, I really don't want to say like I've not directly heard from any campuses, but it may just be I've not, asked those questions before.
Yeah, and I think I can help connect the dot because for our viewers, and I hope you already have a copy, you've downloaded it, you've looked at it online, but if you read the chapter, we've identified these 5 specific strategies for success, and the number one, it's not really in the rank order, but the first one is be strategic. And so this whole idea, again, we go back to the strategic prevention framework, having a strategic planning process that focuses on your prevention efforts, but if you connect that to, okay, well, what happens if?
Yeah. And I think that's the thing, like how often, I think there's that saying of everyone can be a preventionist. Like every person, my goal is that I'm training people to look through at the world through a lens of prevention. And I think so many of our campuses are probably already using a version of the strategic prevention framework without actually knowing that there's like a term
Absolutely.
that connects with it.
I don't even know it.
Yes. No. So I think definitely if you were to sit down and talk to administrators, what is your process for, an emergency evacuation or something like that, they probably, when they start to talk through it, you really could connect it. And I think that's a great way for, if you're having trouble getting school administrators on, maybe that is like that connection factor of like, hey, you already have, like you just commented, you already have a plan for what if someone has heart failure, like you've got the AED, what if, a natural disaster hits, you're going to do this, you've got plans for active shooting. So why wouldn't we also have plans for overdose in hopes that we never have to use it, but it's there and people have been trained on what to do in those cases?
Absolutely, very good point. So now I want to talk about the initiative. What got me, really perked up my ears when I was listening to your presentation earlier this month. So your agency recently started this initiative to create a statewide higher education prevention services network. So tell our viewers about it and what it's intended to do.
So I will say, like, the collaborative is the part that I've been most excited about with this sector. And the idea is, as a funder, I'm kind of holding you to contract expectations. So we're meeting quarterly probably. And that's me giving you training that's like, okay, the next step of the spiff, like this is what we need to be connecting. This is talking about assessment, kind of having more from like that contract monitoring perspective. But we wanted an opportunity for our higher education institutions to just have a space to come together as prevention leaders to network and really brainstorm ideas, realizing that many campuses are probably, struggling with the same issues, and kind of coming together to brainstorm on like those solutions. And I've seen our collaborative hit 1 year in January. We do have a leadership team, and they've been meeting for a little bit longer because they were helping us kind of get this set up. But my goal from the beginning was that this would be driven by the higher education, institutions. Like, I'm that state representative, but I don't want it to be like a state run project. And so that's kind of been like the ultimate goal and the direction that we're going towards with it. And so we bring in for each month, or not each month, we meet quarterly with the collaborative, but it's a time of, hey, this is kind of what's going on in the calendar at that point, or this is kind of a common theme that we're hearing. Institutional resistance is a great example. Like, let's make that like the topic for the next meeting, bring in a speaker, kind of help us kind of talk through things, and then we put them into breakout sessions. So you have the opportunity to be talking with partners from around the state and being able to share those ideas. And so long term, our goal is that, when we start talking about faculty and staff survey, that's something we would love to see happen, is kind of having an assessment for faculty and staff and getting them more included with our prevention efforts that we're doing on campus. Our idea is that we have a data and quality assurance subcommittee, and that like they're going to help drive that force. Our member recruitment committee, we want this to be more, this is our sustainability part of our program. Like if funding goes away, we want this collaborative to continue on, and we want it to be more than just funded providers. We know there are campuses out there, right now we're really reaching out to some smaller campuses of, hey, what type of needs do you have? Like how could we as a collaborative be a resource to you? And like trying to help them with like, here's some no cost, low cost type prevention programming. Policy is a great example. Policy where it costs nothing, but has such a long lasting impact on your campuses. And so that's really the idea, long-term idea of our collaborative, is that we're going to be able to serve as a resource for those 40 plus campuses that we have, whether they're receiving funding from our state or not. And also it just be that kind of connection. We were talking about the very beginning, getting connected with your state agency. Like this collaborative for Oklahoma would be an amazing way for a college to get connected in with the state, and hearing about those resources that we have and how we can maybe help them create some programming, or just really like evaluate what's going on with their campus.
So I'm curious about the structure. Is your role more or less the convener of the schools, and like who is there a leader? I mean, of the group.
We have 4 colleges that we kind of funded from the very beginning. They've been with us from the start. And so those coordinators within those colleges are who we brought on to create our leadership team. And then I'm the state representative on that leadership team. And then we actually have someone who works with community coalition side to kind of bring in that perspective, because he has such a long history with working prevention programs, and he's actually has a history with working with colleges in the past. So we thought he would be a really great way to kind of bring in some of that experience into a group that maybe doesn't have as much prevention experience at this point. And so that leadership team is the group that is driving this collaborative and the direction, and what type of resources we need to create. They're the ones who are helping. We're doing some assessment with campuses that are not already involved and engaged with us, and to see, hey, what would pull you in, what type of resources. Like that is all really being driven by that leadership team that we have created.
Now here's the Rich putting you on the spot moment. You mentioned subcommittees. So how many subcommittees are there? What do they focus on?
Yeah, so we have 3 subcommittees, and that is, I will say, because the collaborative is kind of in its infancy. We're only 1 year into fully running the collaborative. So our subcommittees are kind of that part that we're really trying to get up and going and running smoothly right now. But we have 3. One is that data and quality assurance. So kind of thinking more from that assessment or evaluation side of the spiff, just having a group that kind of can help run that. The other 2 are member recruitment. So what can we do to engage campuses who maybe are already engaged, or if a campus is engaged, how can we keep them engaged, and coming back to meetings and being involved with our collaborative. And then the other one is resources and peer sharing. So they're the ones, I know they've kind of talked more recently about trying to maybe create a campaign for National Prevention Week, where all of the campuses are able to utilize some of the same resources. we have a lot of community colleges that then feed into those four-year universities or four-year colleges. So kind of having some similar programming that can kind of merge. So there's that familiarity with the students. So that's kind of something that they've talked about focusing on. But really, yeah, they're focusing really on how to develop those resources, how to get kind of that stuff out to our campuses across the state.
I think that sounds like a great structure. I was thinking about assessment because we've talked about the SPIF and so why and assessment is so important. And I've said it plenty of times, data drives programming. Um, are the individual schools obviously doing their own assessments, but has the state also considered or have they done any kind of a statewide survey of drug use rates and alcohol misuse rates among students statewide?
So we started out with our two largest universities in the state. That's kind of who we piloted with to start with. And so they both use the National Collegiate Health Assessment, which is really awesome for like that overall well-being. And we as
Right.
a state just paid to add questions around like safe use, safe storage, safe disposal, things that would really drive with the work plans that they would be implementing on campus. As we have started to bring in some of these smaller two-year colleges, they don't already utilize the NCHA, and NCHA can be a bit pricey for a small college who has limited funding and
Right.
resources. And so we have a team of epidemiologists. We also have a team of evaluators that we utilize for all of our prevention programming in our office. And so together they created a mini kind of needs assessment survey that those campuses could administer. I think long term, we've talked about the idea. I've talked to other states who have ended up just really creating one really comprehensive survey that everyone uses in this state or that they fund. And so I think that's a direction I would like to explore kind of in the future moving forward, just to make it a little bit more connected and like collecting the same data from every single campus, I guess is what I'm trying to say. And so I definitely think that's conversation that we're going to be having as we move into the next grant cycle. We have one more full year in this grant cycle, and we have lots of lessons that we've learned of things that we would like to implement going into the next cycle.
So I imagine that with the variety of schools that you have involved, their level of challenges and successes with the strategic prevention framework are just as varied as the schools themselves. Is that true?
I think we've definitely seen that. And, even just the starting points, we had one college that was a part of that initial pilot group, and they already had a campus coalition going. Like it wasn't specific to opioids and stimulants, but they were already bringing people together to talk about kind of prevention needs on campus. And so, where they started versus where a very small institution has started, where, they maybe don't even have a counseling center, on campus, are very different. And so I think for us, we've definitely had to, I wouldn't say tailor, but there's been more walkthrough with like how can you utilize the SPIF, realizing that you've got a smaller population, data may be more limited, like what can you do to still get good outcomes. So yeah, most definitely each campus has needed different assistance in the way we utilize the SPIF, just kind of depending on where they were starting.
Well, I mean, thank you for sharing about the initiative. I know you said it's kind of in its infancy still. And so I know I'll be continuing to watch your progress and what your lessons learned are, and as well as the schools themselves as you continue along in this. I want to move on to my next question. And so I've never hidden the fact I've never worked directly on a college campus. I mean, my entire career has been at government level, state and federal. And yet, I like to think that one of the reasons I have been able to relate so well with colleges and universities, the personnel, over the years is the empathy and sympathy that I have on the various issues that they are dealing with, and that sometimes it is relatable to working in government, that sometimes we share some of the same issues. So I was trying to figure out a way how to massage the question, but what do you think are some common misperceptions about how colleges work when it comes to prevention programming?
I'm hoping I take this the direction that you're hoping it goes. But, I think the first misconception is, going in and realizing everything we do is evidence based. And I think, you can kind of go in, there's those misconceptions overall around like, hey, I'm familiar with prevention in the form of like dare or those, scared straight type tactics. And, I think that can go into some of that resistance that we sometimes see with both government agencies as well as with our campuses. And I think it's, everything we do is so, like you said, data driven now, and everything is evidence based and like, very thoughtful. And so I think that's one misconception that we often are seeing, as we're working with these programs and like reaching out to schools and having those initial conversations. I think um like the way our student population, another misconception is just, you've got to meet students where they're at. Like if you're working with 18 to 24-year-olds, as much as we want to say that we remain relevant, the truth is we become irrelevant pretty quickly. And so I think that's the other thing is like constantly staying engaged with like, how am I going to be able to pull in this population and show them the importance? Like I think about um like norms campaigns and things like that. Like how are we going, what are the current norms that are being experienced, that these kids are thinking are facts, to kind of really combating with our program. And so I think that kind of goes into some of that misconception is like thinking about that normative behavior, trying to meet students where they're at. Um, I definitely think another misconception that maybe we kind of went into at first is that we have all the success with community coalitions, and campuses are a part of that community at large, but campuses are very much so their own community, and the way they
Absolutely.
run is different. And like just that's where you start to get into that government side of things, and with the similarities where they have red tape, they have hoops that they are jumping through, processes that they have to go through, in order. Policy change isn't simply like, hey, here's this like really cool idea. You can get that person that says, yeah, that needs to be made, but it may take you 2 years to go through all of the steps to get that actually implemented. And, I think we experience that with government as well, that something that seems like it should be simple maybe isn't as simple as we think it's going to be. And so I think that's kind of where we can start to see that relation between the two.
So I'm not going to name names, but a very good friend and colleague who I've presented with frequently. So if you guys want to Google that, you can figure it out. Um, she, and there's another clue, has said that while government agencies can be bureaucratic, she does not think that holds a candle to how bureaucratic a college campus can be. She has said that they are perhaps one of the most bureaucratic institutions, that she's ever seen. And, I think of, I laugh at that, but I also think of, sometimes what I've had to deal with, the disconnect, when I worked in a grant making agency, which DEA is not, is, the short turnaround of deadlines for grants that we, used to, we used to put a grant application out on the street for only 30 days. And, we did that because we knew what our schedule was in terms of the peer review process and the awarding of the grants. But 30 days is not nearly enough time. I think you get into the sweet spot maybe at around 6 weeks. That's when you start to get a sufficient amount of time. But I know that I've worked with folks in these agencies that think that that's plenty of time. They know the grant announcement's coming out, and they can put their grant together in 4 weeks and submit it. And, sometimes you have institutions they have the resources to write really good grants. And then you have those that don't. And I think sometimes it shows in that process. It's this notion that they're not just sitting around waiting for us to announce a grant. I mean, there's plenty of other stuff. So I think the bureaucracy that you mentioned is absolutely, true.
And I also think, you have larger, like you just said, you have larger universities, they have like a whole grants department that's their whole job, is just constantly sourcing out grants to bring into their campus. But from my experience, those smaller colleges, they have limited staff or staff that are wearing multiple hats. they're not constantly seeking out those opportunities, which I am happy, though it has presented some of its own challenges. Like we did government to government contracts, so we did not do an RFP process for this first initial. And so that really gave the opportunity for some of these smaller schools for us to kind of onboard them and get them connected. And you talk about the bureaucracy and some of these smaller schools, we have like presidents of of the colleges who are kind of are bought into what we're doing and what we're trying to change on their campuses. And so, I think sometimes too, like getting those, like they're a force to be reckoned with in so many ways. And I think they could have easily gotten overshadowed by like what you're saying, like going through some of those lengthy processes where they just don't have those same resources.
Well, those are great. I'm glad that you identified the misperceptions that you did and ways to even overcome them. I think that that's another. I love the one about evidence-based. I think people have their people that aren't necessarily knowledgeable about prevention have their own perception about what prevention is and what evidence-based is. And I think there's some re-education that can often happen, in that space. So as we wind up, I'm going to end with a question that I always end with all of my guests, and this is to give you the floor. You've had the mic anyway, but now I'm really giving you the mic to basically, offer up your advice. What advice do you have for not only the professionals who are working to prevent drug misuse among college students, but also the students themselves who we know do watch the podcast? What's your advice for these folks?
So I think my biggest advice is always realizing that collaboration is key to prevention work, building those relationships. That's kind of where we started this whole conversation today. And realizing that, you need to find those key stakeholders and start to meet together, build that coalition or that collaborative on your campus. Because I think it's very easy for us to all become very siloed within our departments, and together you can accomplish so much more. So really reaching out, what's already happening on your campus? How can you guys join forces and connect together to build something that's even bigger and stronger for your campus community? I think realizing that, collect that data, create that story, because I think as, you've got to sell prevention and these the potential outcomes that could come from these programs to your administration sometimes. Like we kind of talked about that bureaucracy, and like sometimes it is having to find when they're getting so many emails or they're getting so many conversations, what can you do to set yourself apart to really sell that prevention messaging, that prevention story? And really work towards like a larger solution, such as like policy change, as we've talked about, and knowing that that is such a sustainable, lasting effect. And I think, going off of policy change, I would really encourage everyone to look at what's already there. What type of education are we providing to first year students? What type of programming is coming in for, resident assistants? Are they being trained on what to do and how to respond if they see something? What are you going to do when you have that student who truly needs a stimulant prescription, but is in a shared living space in a dormitory? Like, what type of policies do you already have in plan on how to keep everyone safe and protected? And so really just starting to like look at where you're at is what I would encourage people, and see kind of where do you want to end up and start making that plan. And I think for students, just realize your voice is bigger than you think. I think, having student advisors joining a coalition is so important. Administrators hearing directly from students is powerful, and peer-led initiatives are so effective for campuses. We know that peer-to-peer, there's research that shows that peer-led initiatives can be so effective for this age group. And so just, I would encourage students, realize you can be a part of the change. I started out as I was that high school student who got involved with doing like a peer-led education type program with elementary students, and really just trying to help them build the skill sets of and be resilient. And I'm that college student who was a part of a coalition, and I've ultimately ended up with this as my career. And I think just realizing that you are such a vital part of the solution to these problems. And so I would definitely encourage students to not shy away from having a voice.
Emily, those are some fantastic bits of advice, and I want to thank you so much for being a guest on the podcast today. sharing your information about the initiative, which again, having come from a state, like I said, I cut my teeth in my career in a state that was seen as a leader on this very issue, and that's how my passion for this issue grew. And when I hear other states and see other states doing that, I do get excited, not only for the state agency, but also for the schools in that state. So thank you again so much for the takeaways, and we'll be watching what you're doing there in Oklahoma in a good way.
Thank you so much. Thank you for having me. And, we're excited to continue to see where this leads us.
Absolutely. And so with that, I'm going to say thank you to our viewers. I hope you enjoyed this episode as well as all of our previous episodes, which you can watch on our website, campusdrugprevention.gov. And with that, I'm going to say thanks for watching and have a great day.